The way of learning. Today's topic is cardiovascular system, exhibited for staff nurse entrance. Cardiovascular system summary. The cardiovascular system, also known as the circulatory system or vascular system, consists of the heart, blood vessels, and blood. First question is, which doctor discovered function of heart? Option A, William Harvey. Option B, Robert Koch. Option C, Felix Hoffman. Option D, Aaron Glassman. Correct answer is option A, William Harvey. Next one is, the transportation system of the body is option A, integumentary system. Option B, endocrine system. Option C, cardiovascular system. Option D, urinary system. Correct answer is option C, cardiovascular system. Next one is, all are the organs of lymphatic system except option A, tonsils. Option B, thymus. Option C, spleen. Option D, pancreas. Correct answer is option D, pancreas. Next one is, the purpose of lymph nodes is to trap option A, antigens. Option B, macrophages. Option C, hormones. Option D, RBCs. Correct answer is option A, antigens. Next one is, what is the primary function of the lymphatic system? Option A, transport of oxygen. Option B, regulation of blood sugar. Option C, immune defense and fluid balance. Option D, production of red blood cells. Correct answer is option C, immune defense and fluid balance. Next question is, the apical impulse apex beat of heart is normally felt at option A, left fifth intercostal space. Option B, left second intercostal space. Option C, right fifth intercostal space. Option D, right second intercostal space. Correct answer is option A, left fifth intercostal space. Next one is, the apex of the heart is formed mostly by option A, central ventricle. Option B, left ventricle. Option C, right atrium. Option D, left atrium. Correct answer is option B, left ventricle. Next one is, auscultatory area in left mid-clavicular line at level of the fifth intercostal space is which area? Option A, tricuspid. Option B, pulmonic. Option C, aortic. Option D, mitral. Correct answer is option D, mitral. Next one is, apical pulse is assessed by placing the diaphragm of the stethoscope at the area of option A, aortic area. Option B, pulmonic area. Option C, mitral area. Option D, tricuspid area. Correct answer is option C, mitral area. Next one is, for auscultating the aortic valve, stethoscope should be placed at the option A, second intercostal, right side of the sternum. Option B, third intercostal, left side of the sternum. Option C, fifth intercostal, left side of the sternum. Option D, second intercostal, left side of the sternum. Correct answer is option A, second intercostal, right side of the sternum. Next one is, phallostatic axis is the point at intersection of option A, mid axillary line and line drawn through fourth intercostal space. Option B, anterior axillary line and sixth intercostal space. Option C, posterior axillary line and fifth intercostal space. and option D, anterior axillary line and sixth intercostal space. Correct answer is option E, mid axillary line and line drawn through fourth intercostal space. Next one is, which of the below is not a function of the fibrous skeleton of the heart? Option A, acts as a point of insertion for cardiac muscle. Option B, forms structural foundation for heart valve. Option C, conducts impulses from atria to ventricles. Option D, prevents overstressing of the valves. Correct answer is option C, conducts impulses from atria to ventricles. Next one is, what is called the outermost layer of heart? Option A, endocardium. Option B, epicardium. Option C, myocardium. Option D, pericardium. Correct answer is option D, pericardium. Next one is, the innermost layer of the heart is option A, epicardium. Option B, endocardium. Option C, myocardium. Option D, pericardium. Correct answer is option B, endocardium. Next one is, which tissue layer of the heart wall is the thickest layer? Option A, myocardium. Option B, endocardium. Option C, epicardium. Option D, pericardium. Correct answer is option A, myocardium. Next one is, which layer encloses the valves of the heart? Option A, pericardium. Option B, myocardium. Option C, epicardium. Option D, endocardium. Correct answer is option D, endocardium. Next one is, total number of chambers in human heart is option A, 4. Option B, 1. Option C, 2. Option D, 3. Correct answer is option A, 4. Next one is, how many chambers are there in heart of fish? Option A, 1. Option B, 3. Option C, 2. Option D, 4. Correct answer is option C, 2. Next one is, which portion of heart receives oxygenated blood? Option A, left auricle. Option B, right auricle. Option C, left ventricle. Option D, right ventricle. Correct answer is option A, left auricle. Next one is, deoxygenated blood from body via superior and inferior vena cava is received in option A, left atrium. Option B, right ventricle. Option C, right atrium. Option D, left ventricle. Correct answer is option C, right atrium. Next one is, which of the following contains deoxygenated blood? Option A, aorta. Option B, pulmonary artery. Option C, subclavian artery. Option D, pulmonary vein. Correct answer is option B, pulmonary artery. Next one is, all factors aid in venous return to heart except option A, negative intrathoracic pressure. Option B, one-way valves in the veins. Option C, left ventricular contraction. Option D, squeezing action of major muscle. Correct answer is option C, left ventricular contraction. Next one is, the venous return to the heart is increased by option A, effect of gravity. Option B, respiratory pump. Option C, increased fluid intake. Option D, skeletal muscle pump. Correct answer is option D, skeletal muscle pump. Next one is, which two valves of the heart open during ventricular contraction of the heart. Option A, aortic and tricuspid valves. Option B, pulmonic and aortic valves. Option C, pulmonic and tricuspid valves. Option D, aortic and mitral valves. Correct answer is option B, pulmonic and aortic valves. Next one is two major opening of the left ventricle are option A, tricuspid valve and pulmonary artery. Option B, bicuspid valve and aorta. Option C, inferior vena cava and aorta. Option D, pulmonary vein and aorta. Correct answer is option B, bicuspid valve and aorta. Thanks for watching. Like, comment and subscribe the channel.